பற்றி சில விஷயங்கள் சொல்லணும். யார் அப்படிங்கிறது, அவர் வந்து இந்தியாவில் இருக்கிற டாப் 5 ரினவுண்ட் நெஃப்ராலஜிஸ்டில் ஒருத்தர். அவர் 84லேருந்து கிட்டத்தட்ட நெஃப்ராலஜி ஃபீல்டில் நிறைய சர்வீஸ் பண்ணியிருக்காரு, வேரியஸ் ஹாஸ்பிட்டலில் ஒர்க் பண்ணியிருக்காரு, நிறைய 1000 மேலே சர்ஜரிஸ்லாம் பண்ணியிருக்காரு. இப்போது அவர் வந்து இதெல்லாம் பார்த்து சால்ட் ரிடக்ஷன் அதுதான் அடுத்த கட்டமாக லேட்டஸ்ட் சினரியோ நம்ம இதில் இருக்கு. சர்வீஸ் எல்லாம் ஏன் கவர்மெண்ட்டுக்கு நீங்கள் கொடுக்கக்கூடாது, சேர்ந்து பண்ணக்கூடாதுன்னு. கண்டிப்பாக சார், ஃபின்லாந்து, ஆஸ்திரேலியா, கனடா, இல்லை இங்கிலாந்து, இங்கெல்லாம் வந்து கவர்மெண்ட்டும் என்ஜிஓவும் சேர்ந்து தான் ஒர்க் பண்ணுறாங்க. நான் என்ஜிஓ, நான் வந்து கவர்மெண்டோட சேர்ந்து ஒர்க் பண்ணுறதுக்கு நான் தயாராக இருக்கிறேன், என்னை யூட்டிலைஸ் பண்ண நல்லா இருக்கும் அப்படின்னு சொன்னார். அதனால அவரை நான் நம்ம டைரக்டர் கிட்ட கேட்டேன், இந்த மாதிரி உடனே அழைச்சிட்டு வாங்கன்னு சொல்லி அவர் பார்த்தாரு, பேசினாரு. அவருடைய முதல் முயற்சி தான் இது. அவர் 2 கான்ஃபரன்ஸ் பண்ணியிருக்கிறாரு. ஐஐடியில் சால்ட் ஃபைட்னு 2017 ஒரு கான்ஃபரன்ஸ் பண்ணியிருக்கிறாரு. இப்போ 2வது கான்ஃபரன்ஸ் இந்த ஜூன் 30th பண்றாரு. ஸோ அந்த கான்ஃபரன்ஸ்லயும் பல விஷயங்கள் விவாதிக்கப்பட இருக்கின்றன. ஸோ நம்ம டிஸ்ட்ரிக்ட் ஹெல்த் ஆஃபீஸர்ஸ், அங்கே இருக்கிற மெடிக்கல் ஆஃபீஸர்ஸ், இவங்களுக்கெல்லாம் அது போய் சேரணும். அதாவது ஜஸ்ட் கிரியேட்டிங் அவேர்னஸ் அபவுட் சால்ட் தான். அதை அவர் சொல்ல வந்திருக்காரு. ஏன்னா அவர் தமிழ்நாட்டில் உள்ள எல்லா பிரபலங்களுக்கும் அவர் பிசிஷியனாக இருந்திருக்கிறார். அவர் அதனால கீழே டவுட் சாதாரண ஒரு ஏழையில இருந்து மிகப்பெரிய ஆள் வர இருந்து ட்ரீட் பண்ணதுனால அவரோட அந்த எக்ஸ்பீரியன்ஸ், அப்புறம் பல்வேறு இன்டர்நேஷனல் கான்ஃபரன்ஸ்ல அவர் கலந்துக்கிட்டு அதுல கிடைச்ச அந்த விஷயங்கள் இதெல்லாம் தான் நம்மளோட ஷேர் பண்ண வந்திருக்காரு. அப்படிப்பட்ட டாக்டர் ராஜன் ரவிச்சந்திரன் சார் தன்னுடைய நேரத்தை ஒதுக்கி இங்க வந்து எங்கள் முன்னாடி வந்து சொல்றதுக்கு அவருக்கு எங்களுடைய பொது சுகாதாரத்துறை சார்பில் நன்றியை தெரிவித்துக் கொண்டு அவரை பேசுவதற்கு அழைக்கிறேன். அடுத்ததாக அவரை கௌரவித்து நமது இயக்குனர் அவர்கள் சிறப்பு செய்வார்.
Good afternoon, everybody. I am very happy to be amongst you today to talk about a very important topic. And there is an urgent need for reducing salt intake in this country. I am sure by the end of my lecture you would be convinced of this. My special thanks to Dr. Selva Vinayagam and Dr. Nagarajan for making this possible today. So which is the number 1 killer in the world? I'm sure all of you know, hypertension. So this is an old figure, about 5 years back. Now it's gone up further. It's, according to WHO, more than 10.8 million people die every year due to hypertension and its related complications of chronic kidney disease, cardiovascular episodes and strokes. So it's very important public problem. You are aware that I'm sure all you know that almost every 3rd person has hypertension. It depends on the definition. Now you find that in the US they have brought it down to 120/80. If you take 120/80 as a cutoff, almost 50% of the population would be hypertensive. So if you take 130/90, it's almost 30 to 35%. India falls around 35% with whatever figures we have. It could be more. Next, how do I go? Yeah, so what puts up? Wherever I give a talk, I ask them, what do you think is the cause of blood pressure? The first answer I get from lay people as well as medical people is stress. Sir, stress is the cause. Stress is not the cause, believe me. Stress transiently produces your blood pressure to go up because of the hormonal changes, but it is not sustained. It comes down. I'll show you an example of it. So the most important thing is the salt intake. So the salt intake over generations has made this normal blood pressure of 130/90. Potassium. Potassium has the opposite action of sodium. So if you give potassium, actually the blood pressure drops. The third important point is weight. Obesity is a big problem. So you find that the blood pressure is being pushed up. Lack of exercise. That's a very important point. Husband, wife, both are working, not sufficient time to do exercise, lack of exercise. Schools don't have playgrounds, schools don't have sports center, lack of exercise. They're all with the media, they are with the laptops or with the iPhones or phones. So nobody had, the exercise has come down amongst children. Alcohol excess. Alcohol transiently raises the blood pressure. Next one. Look at this South American tribal man. Now he is never exposed to salt. He has never seen salt in his life. What do you think his blood pressure is? His blood pressure is only 90/60. For generations he has not seen salt. He has never eaten salt. His blood pressure is 90/60. And he has all the stress. Actually, he is a tribal man. He lives in the forest. He is surrounded by wild animals. And I believe in his village, the women are less than the men, and there is always a demand for women getting stolen. So there is always stress. He is worried of losing his wife. He is worried of being killed by animals, but still blood pressure is only 90/60 because he has never tasted salt in his life. Next one. The chimpanzee. If you take the chimpanzee and see in the wild, the blood pressure is 90/60. The same chimpanzee has been put in the New York Zoo and given the human diet. What is the blood pressure? 130/90. So if you eat the human diet with salt, yes. Whereas in nature, the blood pressure is only 90/60. Next. So there are several studies, epidemiological studies, which have shown the correlation between salt and blood pressure. And intervention. If you have reduced salt, the blood pressure falls, the mortality falls, morbidity falls. Genetic mechanisms. Genetic mechanism is very important to know because salt sensitivity depends on the genes. You will ask me, there are two people. He is eating the same salt, he is eating more salt than me, I am eating less salt. Why is my blood pressure more, his blood pressure less? This is because of a thing called salt sensitivity. A person who is sensitive to salt, his blood pressure varies with salt intake. What happens is, if he takes more salt, the blood volume goes up and the blood pressure goes up because the blood vessels vasoconstrict. Whereas if he is salt resistant, the blood volume goes up, the blood vessel produces nitrous oxide, which will produce vasodilatation, and you will find that the blood pressure does not go up. So you will find that people can take the same amount of salt and the blood pressure different. So this is the genetic mechanism why some people are more salt sensitive and some are salt resistant. So the animal experiments, chimpanzees, has been well shown. There are several treatment meta-analysis which have shown mortality studies, population studies in Japan, Finland and UK. Finland was the first country in the world to pass a legislation on restricting salt intake. That was because they were having very high incidence of strokes. And after reducing the salt intake, there was a dramatic drop in the incidence of strokes. Same thing happened in Japan, which I will come to it a little later. Next one. So UK. UK's program is very interesting. The Englishman, his staple diet, morning breakfast, afternoon lunch, night dinner is all bread. So he eats bread for all 3 meals. So the people don't know that if you take 5 slices of bread, the maida, what you call the white bread, your day's quota of salt intake is over. So imagine, and the UK man takes bread for all his meals. So this was a big problem in the UK, and the biggest problem because of this was stroke. Stroke, the danger of stroke is that the person would not die. So he would be on a big problem onto the budget of the state government. The state government has to take care, the government has to take care of the stroke patient. They have to send nurses home, and he is going to live 5 years or 10 years bedridden. See the expense that is involved and the suffering. So stroke is the biggest problem. So then UK decided on a salt reduction program. So they brought down the salt intake to 5 to 6 grams. How did they do it? It's very interesting. What they did was, if you tell people that the salt is reduced, they will not like to eat the food. So every year, they reduce the salt intake in bread by 5% without telling the population. So by the end of 5 years, the salt content dropped by 25%, but nobody knew that the salt has been reduced. If you ask the UK man, he will say the bread is same 10 years back and today. I tried this experiment in the club, in Madras Club here in Chennai. I told we have a bakery. I told them reduce the salt by 10%. There was no complaint. Nobody comes to know. Actually, if you reduce the salt, people don't complain. We have to do it progressively, slowly. So then they brought down strokes and heart deaths, and they have saved so much of money on that. Next one. Japan. As I said, in 1960, as early as 1960, Japan had the highest incidence of strokes in the world. So you found that the Japanese government had a program to reduce salt intake. And the Japanese people were on an average taking 13.5 grams of salt per day. So then some places it was 18 grams. So imagine the amount of salt that the Japanese people were taking. So the government came on a program to reduce the salt intake. There was a drop in the stroke mortality in spite of the Japanese people smoking at that time. So the benefit of salt is very important. I will explain to you a little later why it happens. Next one. What does the WHO recommend? The WHO recommends 5 grams of common salt per day. Now, when I tell a patient you are allowed 5 grams of salt, they don't understand. They think in addition to whatever they eat, the cooking or the food, they are allowed to add 1 more spoon of salt. So they have to understand this 5 grams is from all sources. That is salt that is present in natural food. That itself is 1 gram, 1 to 2 grams. Say you take a green leafy vegetable or anything, it has sodium chloride in that, sodium in some form. Then the salt is added while cooking. Then the third one is the hidden salt, or which is present in the preserved food. So you have pickles, papads, you have, of course, nowadays noodles, you have pastas, so many preserved food. Even in the airlines, you are served with noodles, which you just add water, boiling water and eat it. All of them, how is the noodle preserved? It's because of the salt. So salt from all sources, it's impossible. It's very difficult to keep your salt intake to 5 grams. Imagine, natural food, salt added during cooking and preserved food. All that inclusive is 5 grams. 5 grams is what? 1 teaspoon. Very difficult to keep it restricted. So what is more important is even if you make an attempt to reduce by 10 to 20%, you are going to have a benefit. This target of 5 grams can be achieved over years. But the target is set as 5 grams. Now a slight clarification I want to make. See, the culprit in salt is sodium chloride. So sodium is the culprit which is responsible for damaging the blood vessels. It affects the lining of the endothelium cells. That's why you can get strokes and heart attacks even without the blood pressure going up. This is very interesting. So you will say there are so many people who have a normal blood pressure. Still he has got a stroke or a heart attack. Why is it so? Because the endothelial function is damaged by salt even if the BP doesn't go up. So we had Professor McGregor. He said he had been in our salt conference in 2017 at IIT. Professor McGregor had come. So one of the persons who got up and he said, sir, I have a doubt. My blood pressure is only 110 by 70, he would remember. But my general practitioner tells me to take more salt. So he came down from the stage, Professor McGregor, and he said, congratulations, your blood pressure is low. Please change your GP. So your damage to the blood vessel happens even in spite of a normal blood pressure. So you have to understand this. Don't think just because your blood pressure is normal, you can eat high salt. See, this is a common misnomer. A lot of people will say, avaru sir kashtapadrar ena avarku BP irukku avaru saapida koodadhu. Yen BP normal irukku na yen uppu koraikanum. So this is a question which is often asked. So you can get heart attack and strokes and kidney disease even in presence of a normal blood pressure or low blood pressure. So sodium is 1 gram of sodium is equivalent to 2.5 grams of sodium chloride. So you have to understand this because some of the food labels still don't mention as sodium chloride, salt. They will mention it as sodium composition. So sodium, the WHO allows you only 2 grams, which is equivalent to 5 grams of common salt. Next one. So what is salt? Salt or sodium chloride is nothing but a preservative. It was discovered about 8,000 years back. Man was going for hunting in the summer months, and when the weather was bad, he had to preserve the food. How do you preserve the food? So he found out that if you add salt, the bacteria don't grow. You know well. Uppilla pandam kuppaile. If you don't add salt, it will rot. You make a sambar in the morning, don't add salt, by evening, usipedo. So because the bacteria will grow if there is no salt. So the effect of salt is a strong preservative. So the fish was stored in brine water. So that used to keep the fish for 6 months. That's what we do in Urga. The shelf life of a product depends on the sodium content. So if you have salt, the shelf life is prolonged. So if you say Urga is lasting for 1 year, it is because they have added lot of salt in it. That's why it is not getting spoiled. Colgate says we have salt in our toothpaste. It kills the bacteria. So if salt can kill a bacteria, it can kill you in a high dose. You keep salt and sugar, the ant will go to the sugar, never to the salt. Even the ant knows salt is a danger. So it's a preservative which was discovered 8,000 years back. It was so important in those days. The Romans, the word salt has come from salary. The Roman, Greek word on salary. So the Romans used to give it as a salary, a bag of salt. So salt was so important in those days to preserve food. Next one. The studies that we have, how much salt do we think Indians take? India is a huge population. And we have cultural differences. We have differences in the food habits. So, but the studies we have done are very few. But we have about 1,500 people who have been studied. That's the largest study. And you find that average intake of salt in India is about 10 to 15 grams. Could be more also, based on the cultural practice. How do we make out how much salt you are taking? See, the best, if you give a survey, people invariably give a wrong answer. I mean, they don't want to accept that they take more salt, or they write without precision. So you don't get correct data. There was a study done in Andhra on a survey basis. It was shocking. They found that the average intake of salt intake in Andhra was 35 grams. Of course, it was a wrong methodology. What they said was how much salt is bought by the family, how much is used at the month end, divided by the number of people, and they calculated it. So it gave an answer of 35 grams, which is phenomenally high. So it is wrong. So how do we make out? See, in a steady state, whatever salt you take goes only in the urine. This is very interesting to know, because people think sweat, you lose salt. Sweat does not remove so much salt. So you will always think, oh, summer I am sweating more, I can take salt. No. Once you are acclimatized, the composition of sodium in sweat is only 5 milliequivalents per liter. Urine is almost 140 to 200 milliequivalents per liter. So whatever salt that you are taking in a steady take is lost in the urine. So if I want to know what is the salt intake, I will do the 24 hours urine sodium collection. So if I do your sodium collection, I'll know how much salt you have taken. So when a patient tells me, sir, I eat less salt, I know that's not the way to know. Do a 24 hours sodium, and we are surprised that he has been taking much more salt than what is recommended. That is the gold standard. Next. So I told you this. How does salt occur? It is naturally present. It is added while cooking, while processed food. Processed food is growing up. See, this industry, husband, wife, both are working, children are going to school, children are now love processed food. There was a move even by railways during COVID to introduce processed food. The railways are very courteous. We wrote a letter from Sapiens Health Foundation saying that I saw a news article saying that they are going to switch to processed food. They will be serving sealed containers, which are already prepared. Then we wrote to them, and normally the freshly cooked food has less sodium. So traditionally railways has been serving idli, sambar, vada, etc., dosa, which has less salt. Compared to if you start serving noodles, pasta, or other preserved items, fried rice, which is already made, which all contains high salt. So processed food is called the hidden salt, because you don't know how much salt is there unless you look at the label. How many people will look at a label to know how much salt they are taking? Next one. There is a myth. Let's look at some of the myth that you require salt for a tasty food. This is not so. See, your taste buds get saturated. The more salt you take, you require more salt. If you Stop eating salt for 2 weeks. After 2 weeks, you will start appreciating even small amount of salt. You will say, the karikirudhu, somebody else's food. And not only that, salt is a dominant taste. Once you remove salt, you will appreciate other tastes. Pulippu, karam, uvarpu, ellam, you will appreciate only when salt is brought down. If salt is there, it will, if you are cooking, the French used to say, if your cooking is bad, add more salt. So you can't understand the flavor. You can't appreciate the flavor. A French chef wants to bring out all the flavor, he will say add less salt. You can bring out the flavor of the vegetable, the onion, the garlic, everything, if you have added less salt. So salt is not necessarily a must for tasty food. Children require more salt. This is again a very sad thing. Children require much less salt. Actually, in the first year of life, you should not give salt at all. In the UK, in the schools, food is served without salt. More salt is required in hot weather. This is what I said. Sweating, once you get acclimatized, contains basically water. So what you require is to drink more water rather than take salt. Next. Of course, this is a slide how to bring down to 5 grams. What are the ways you will do it? Like you can wash the salted item, you can use spice, you can remove the salt shaker from the table. So this is a nice slide. I've given it in the book. The whole thing is explained in the book also. How we can reduce the salt to 5 grams per day. Next one. So there are other damaging effects. It's not just blood pressure. People know about blood pressure. I don't require to talk about it. Even a layman, salt and blood pressure are connected, they are aware of it. But there are other problems with salt. You can get cancer of the stomach, strokes and heart attacks, as I said, even in presence of a normal blood pressure. Kidney disease, again, protein leak. It's very interesting that if you give more salt, more protein leaks in the urine. So in Tamil, it is very interesting how patients say, sir, urine la uppu irukku. They call protein as uppu. Salt also is uppu. So for a patient, both are uppu, but there is a connection. Interestingly, sodium chloride and protein leak are connected. So it has been shown that if you give more sodium chloride, more albumin leaks in the urine. So as you know, once you produce proteinuria, the kidney damage worsens very fast. Kidney stones, very interesting. The sodium, when it goes in the urine, drags calcium with it. So the calcium forms stones. So that's why you get stones, because you take more salt. The first thing we tell a person who forms kidney stones is reduce salt intake. This is not appreciated by many. If you reduce salt intake, you will form less stones. Same thing, osteoporosis. The calcium is dragged from the bones in the urine. You take more salt, more sodium goes in urine, it drags calcium from the bones. So you get osteoporosis. Next one. So who is responsible for reducing salt intake? First and foremost, which we have been doing for the last 13 years, is to educate the public. First, we have to educate the public. This is where we require the help of, and Dr. Selvavinayagam and Nagaraj have been very kind enough that so many public health centers are involved and a large population can be reached. So they can be given some education. A poster can be kept mentioning the importance of reducing salt and what all benefits that they can get. Simple measures to reduce salt intake can be done. Of course, the government, in passing a legislation, I'll come to it later, there are 64 countries in the world who have a law for salt regulation, either voluntary or by legal methods, that you have to reduce the salt in processed food. Food industry. Food industry can do it by themselves, which we have appealed to. We have written to 300 food manufacturers asking them to reduce the salt intake and use other methods of preservation. Vacuum or freeze or some other methods. Now refrigerators are available in large way. You don't require salt to be added as a preservative. So next one. So this is very interesting. The food label. How do I know how much salt to take? If I look at it, very unfortunate. We have written to the Food Safety Standard Associations. The print, first of all, the content is in such small print that you require a lens to study how much it is. Very often they write in very small print. So it is not clear. Second thing is, how does the layman know how much salt to take? 5 grams, 4 grams, 3 grams and all. This is not right. You can't expect. Even a doctor will not know how to. So how do you expect a layman to know? So follow the UK signal labeling. So for three things, for sugars, fat, saturated and salt. So all four, what you do is, you have a signal labeling. If it is red, it is dangerous. Don't go near it. If it is yellow, some risk. Green means it is safe, it is low. So make this signal labeling. So put a signal labeling for salt, sugar, trans fat, you know what it is. So public can just look at it, give them salt, low salt substitutes. Today I think we will give you a unsalted snack. Please taste it and let me know how it is. We have just added other spices and totally kept salt free. We could have made it even low salt, but we have made it unsalted. So you can have give the opportunity for people to choose. You go to the US, you know, you have a low salt, low fat milk, 1%, 2%, 3%, 4% in the supermarket. You are given a wide choice. You go to the Heathrow airport, there is the chips available, low salted, normal salted. Whereas in India, you don't have a choice. Where is the choice for you? You go to the supermarket, your children nowadays want all these items. You can't deny them the chips. You have to accept them, give it to them. But how do you give it? At the same time in a safe way. Have a signal labeling. This we have been trying to fight with the government. The other thing is sodium labeling in India is not still mandatory. Sugar is mandatory, trans fat is mandatory, but not sodium labeling. So this should also be made mandatory. Next one. As I said, countries with salt targets, both voluntary and regulated, several countries have these salt legislations. Next one. So the Sapiens Foundation. Sapiens Foundation is, I started in 1997 actually to help patients with kidney disease. I have been in practice since 1994 for 40 years. So one of the biggest problems we face in practice is that halfway through the patient doesn't have money. What do you do with these people? The hospital management is not interested in helping them, and we feel bad to send them to a government hospital. I'm sure the government doctor would feel bad that somebody has been treated outside, lost all his money, and he has been sent to him. So it's a very tricky situation. How do we help? That's where one of my patients suggested, and we started the foundation in 1997 to help these patients when they halfway through the treatment. For example, dialysis, kidney transplant, or whatever it is. In those days, cost of dialysis in Vijaya Hospital was 450. We used to give 50 rupees from the foundation, and that made a big difference. So we started the foundation. Next one. So it was started by my own patients donations, and of course it was run by my own patients and for the patients. This is an article which came in Indian Express in 1999. Next one. I used to deliver lectures, awareness lectures all over the state, especially in many of the Chennai situations. This is one in the Raj Bhavan. The governor is sitting next to me. The maximum questions that day were asked by the governor. He asked me about 7 or 8 questions. He's Ram Mohan Rao in those days. Next one. Of course, we started our preventive program in 2005 with Japan. See, Japanese people are the world leaders in prevention, especially with reference to kidney disease. They had a common kidney disease called IgA nephropathy. So this IgA nephropathy, they had maximum patients on dialysis in those days because of IgA nephropathy. So what they did was, they made it mandatory that every year, every child in a school, the urine will be tested for protein leak and RBCs. If you detect it at that stage and treat, they prevented them from landing up on dialysis. So unfortunately now India has more IgA nephropathy. Japan doesn't have IgA nephropathy. It's dropped drastically. So in 2005, Professor Toma and Tanabe from Tokyo visited us, and we started the program of screening the schools in and around Chennai. Next one. This is the world president, Dr. Fihali, who came to us in 2009. The important theme was that the laboratories were not standardized. Even now they are not standardized in the country. I tell a patient, you have got a kidney failure, looking at a serum creatinine report. And say if it is 0.9, I calculate the eGFR, it is normal. If it is 1.2, he has a kidney dysfunction. Imagine, a reading of 1.2 and 0.9 makes a difference. And in India, the laboratories are so different. I do a test in my Meot, it will be 0.9. He does it in Thambaram, it is 1.5. He has a kidney failure. So we have not standardized. This is a very, very important point. Labs should be standardized in this country. Then only our diagnostic skills and management will improve. The next one. Of course, we had a very simple website. The two leading causes for kidney disease is diabetes and blood pressure. As you know well, if I ask a patient, do you have diabetes? He says no. If I ask him, you have sugar? He says yes. The same thing for hypertension. You ask for hypertension, he doesn't know. You tell him you have BP, he says I have BP. So the website is called sugarbp.org. We launched it in 2009. Some basic tips for people with diabetes and blood pressure, how to prevent it, prevent kidney disease. Next one. Of course, this was the John F. Halley. I'm sorry. The other one was different, where we spoke about the standardization of the tests. Next one. In 2010, we started our program against salt reduction. So this is a Marina walkathon we had with Crazy Mohan and of course the UK ambassador with us. And we started the salt walk where we wanted to create an awareness. So we started it in our salt reduction program in 2010. In the world, the first program which officially was started in 2005 by the WASH, World Action on Salt and Health in the UK, by Professor McGregor. So we started in 2010. So this is a walkathon march. We had it in Chennai, we had it in other cities also in Tamilnadu. And we got the award from the World Hypertension League in 2015 for the notable achievement of salt reduction in India. Can we get the next slide? Yeah. Yeah. Right. The next one. This is in Trichy we had. Pondicherry, Puducherry. Next. Trichy. Yeah, this is a self-detection kit. This is nothing but a strip we launched that you could dip it in the urine like testing for sugar, test for albumin, you know that you have a kidney disease or not. This we have been promoting in school students, distributing the kits and asking them to get back the feedback as to if there are protein excretion or not. We presented the data in the US. About 6%, 5 to 6% had abnormal proteinuria in the urine in the college students. Because it's very important to target young.
Sorry to interrupt, sir. What is this kit, sir, actually?
This is nothing but a strip. Our regular, what you do for your sugar strip, similar to that. These strips contain now for sugar, protein, they contain for blood. So these strips are like, you just dip it in urine, you get a reading.
Just for albumin and RBC.
Yes, it tests for albumin and RBCs and sugar. Yes, it's very important. I think you have a program also where you are launching, you are doing it. Yes. Next one. Of course, the rare disease, orphan disease called cystinosis. We sponsor the treatment for this rare disease. There are 2,500 children in the world. We have 46 children registered in India. We are the 11th foundation in the world, the Cystinosis Foundation of India. Next one. These children, can you go back? You'll be surprised. These children are not grown. It is unfortunate they are diagnosed so late. The child who is in that mother's hand, he is 13 years of age. Imagine the lack of growth. See the other children, they are also so small. They are all 8 years, 9 years. The growth is affected because of this cystine which gets deposited in various tissues. Next one. Of course, every year we celebrate the World Kidney Day with a celebrity and talk about important topics. This was one on acute kidney injury where the kidney failure can be prevented, how it can be prevented. The next one. Kidneys age, tips for the old people, how to protect their kidney. As you age, your ability to excrete salt goes down. You require more potassium, you require more water intake and you have to know that use of drugs have to be cautious once you age because all medications invariably are removed through the kidneys. Next one. PDSS program, this again the government of Tamilnadu is also doing it now. We started it in 2015. What we were telling is, why are we spending on hemodialysis? They go to the hospitals, and then they have to spend the whole day there, 2 days, and attendance time is wasted, and he has a treatment, exposure to blood, viral infections, so many issues. Why not dialyze yourself at home and go for your work 6 by 7? Dialyze yourself at night. So this is the peritoneal dialysis. So we promoted a PD assist program, the first of its kind in the world at that time, in 2015. We said that you buy 2 bags, we'll give 1 bag free. We didn't give the whole thing free. But now Tamil Nadu government is doing it. They have, I think it's one of the programs in the country that they are leaders, they have people who are on peritoneal dialysis. So PD is a very useful treatment at home. It should not be reserved only for those people who are in ashrams or who are in secret places should have PD. Everybody should have access to peritoneal dialysis. Next one. Of course, we have a lot of Tamil street plays. They're very interesting. If you can Google it, it's a very humorous play. It lasts for about 45 minutes. We do it in all lower economic strata places in Tamil only. Give simple tips about blood pressure, diabetes, weight reduction. People don't know that even amongst the poor, hypertension is a huge problem. Hypertension and diabetes are not necessarily a disease of the rich. That concept has to be removed. So poor people also have all these issues, and many of them eat very high salt, are not aware of their blood pressures, and they come for the first time with a malignant hypertension, admitted directly in the hospital with 200 by 140, 150 blood pressures. Next one. Of course, in children, we had a program, how to detect kidney disease in children and how do you treat it. Next one. So this is a program we have every year, the World Kidney Day. This is the SALT conference, healthy lifestyle, again on the World Kidney Day. The next one. We had the SALT fight, the first conference in 2017. And that is the Professor McGregor from the WASH. We had Soumya Swaminathan, who was with the WHO, Dr. Muralidharan from, and I think he's sitting, right? Yes. So this was and Anita Makija from the Food Safety Standard Association of India. So we had a SALT fight conference in 2017. Next one. Kidneys and women health. Women are more prone for kidney disease because of one, the urinary tract infections are more, and also during pregnancy is always a stress for the kidneys. Kidney disease worsen during pregnancies, blood pressures go up during pregnancies. And of course, unfortunately, women still in this country are not, they don't get the same level of treatment as the man. So that's again an unfortunate thing. So this was a program we had in 2018. Next one. Of course, we had Crazy Mohan used to be our main ambassador. So he always used to say, salt illa salta irkadinga. Uppilla pandam kuppayile, uppilla pandam toppayile. So he had a lot of such anecdotes, and Crazy Mohan was our ambassador. Avoid the salt shaker. This is a program we had it with many restaurants in Chennai. I told the restaurants, don't keep the salt shaker on the table. The soup comes, they don't even taste it. They just talk to each other, they go on adding salt. So already the cook has added the salt. This man is adding salt over it and he is talking and eating it. So please don't keep the salt shaker. If you want a salt shaker, please ask for it. So ask for your poison. Don't serve it to this thing. So many restaurants we approached and they have been helpful on that. The next one. Of course, we had an essay competition in school children. So there's a very tremendous response. So we make them write an essay on salt and health and we give them an award, and children are amazing. They not only remember well, they Google so well, much better than us. And they collect so much information and these essays are very popular. Next one. So this is again a World Salt Week. We had it in May 17th to 24th. This year also, every year we have the World Salt Week. We launched the low salt snack at that time. Today we have given a sample to all of you. Have a taste of it. Next one. Yeah, living well with kidney disease. How we showed how people can be rehabilitated fully. You may be on dialysis, you might have had a transplant. Nobody should know it. You should be able to do all your activities. You should be back to job. That should be the quality of request which I have to the Tamil Nadu government. See, one of the problems in dialysis is that reuse of dialyzers. These dialyzers are reused several times. Unfortunately, the quality of dialysis comes down and patients get hepatitis C, B and other complications. Whereas in Andhra also, the government took a program that you should use a single-use dialyzer. The quality improves dramatically. I went to Japan in 1997. I saw the dialysis unit. The fellow comes in the car, he parks it, he goes to the dialysis unit walking. You don't know whether he's a patient or he's a doctor. He goes and undergoes dialysis. He comes out, walks back, drives the car and goes home. And back in his job. That's the quality of dialysis. So we should concentrate on the quality of treatment. See, helping poor doesn't mean cutting the quality of treatment. So this is where I think we should raise more ways. What is the cost of a dialysis even if you use a single use? It is only 2,000 rupees. Whereas if you go to the US, a cost of dialysis in the US is 25,000 rupees. The same dialyzer, the same machine, the same disposables, they charge 25,000. We are worried of charging 2,000 rupees. So we should realize that 2,000 nowadays is nothing. So it's abroad, they are all, in Mayo Center, one of my VIPs went, the cost of a single dialysis is 1 lakh rupees per dialysis. Exactly the same specifications. Nothing different. So we should provide high quality treatment. We should raise money. We should raise financial help. That's what we do in our foundation. Don't reduce the quality, raise money. Go and ask for help. A lot of people don't know where to donate. So there are people who don't know where to give the money. And there are people who die because of lack of money. So we have to be a bridge. We should be able to do that. Next one. Knowledge gap again, to improve the knowledge on kidney disease. The next one. Of course, we had the Silver Jubilee celebration last year. We had the superstar talking about salt, which is a video which you could hear. He has spoken very well. Of course, Venkaiah Naidu also was there that day. Next one. So there is the latest venture is the low salter group. I want you to log into this website and become a member of the low salter group. We are going to have a conference on June 30th at IIT. It's not a conference, it's a half-day workshop. We start at about 9:30 and finish by 12:31, followed by lunch. The registration is free. We will open for registration next week. We would want the doctors to be empowered first, get knowledge about salt and health so that it can be dissipated and they can act as ambassadors and play a crucial role on this very important public health problem of urgent need to reduce salt intake in this country. Thank you.